Now, we really look at the next medical condition here, and this is the men type 2. Okay? Men type 2. So it's a syndrome. That means a constellation of signs and symptoms. You have a lot of signs and symptoms under this. Okay. So just so you know, it's a rare inherited cancer syndrome and it's caused by mutation in the RET proto-oncogene. So when you have it, there's a higher risk of you having what? Cancers in the thyroid, okay, cancers in the adrenal gland, and also cancers in the parathyroid. So it's an autosomal dominant mutation. The gene affected is the RET gene. So each child of someone that is affected has a 50% chance of inheriting it, you know. So the subtypes, we have the MEN2A, which is medullary thyroid carcinoma. We have the pheochromocytoma. We have hyperparathyroidism. Okay. Then we have the MEN2B, it's more aggressive. Then we have the FMCC, which is the familial medullary thyroid carcinoma. Okay. So clinical features here is for the medullary thyroid carcinoma, it's often one of this, like is what will actually bring up the signs early. Okay, can occur in childhood and also adolescence. You know, it's very aggressive. So pheochromocytoma is a tumor of the adrenal medulla. Okay, so it produces a lot of catecholamines, right? So it can cause the person to have hypertension, palpitations, the person sweat a lot, there's a lot of headache. So to say everything in the body is on the high side. So the hyperparathyroidism there just have to do it. The parathyroid hormone is produced too much. So you have hypercalcemia, you have kidney stones, you have bone pains. Okay. Then you can also have neuromas on the lips, on the tongues, the eyelids, the rest of it. So diagnosis is genetic testing because you want to identify that there's a mutation in the gene. If you check the family history, at least the relative, you see that a relative have this issue too. Then biochemical markers. Okay, so you have all those calcitonin, plasma, methane, phrines, you know, then calcium. Hyperparathyroid. Okay, so parathyroid levels are actually high. So you manage it by you actually remove what the thyroid hormone, the thyroid gland in total. Okay, because there's a risk of cancers in it. You know, then what again? Pheochromocytoma is you surgically remove the adrenal gland. Then parathyroid hormone being excess, you surgically remove the parathyroid gland. You know, and also targeted RET inhibitors like the salpecatinib and the pralsetinib. So that's what we got for this.